If your skin reacts to everything, breaks out easily, or keeps getting darker no matter what you use, the problem may not be the treatment, it's that your skin barrier isn't ready yet. I'm Dr. Nora, I'm a medical aesthetic practitioner, and in this video, I'll explain how to repair your skin barrier before you treat acne, pigmentation, or any form of sensitivity, because treating damaged skin only makes things worse. And the reason why you must repair the skin barrier fast is because when the barrier is damaged, the skin is already inflamed. And inflamed skin doesn't respond predictably to treatment. And I've said this before, when you apply active ingredients on compromised skin, guess what? Penetration becomes irregular. Some areas absorb too much, while other areas don't respond at all. This is why treatments seem to stop working or suddenly cause irritation, even when they worked before. So the issue rarely is that the treatment is wrong, it's that the skin isn't ready. So I'm sure you're asking how you can tell whether your skin is ready for treatment. So there are very clear signs that the skin barrier is not stable enough for active treatment, like stinging or burning with products that are meant to be gentle on your skin, a moisturizer that feels like it just sits on your skin or doesn't seem to help, redness that lingers long after application of a product. And a very important one is when you're dealing with breakouts and pigmentation at the same time. This usually tells me the skin is inflamed and reactive, not just acne prone or pigment prone. So, in this state, adding stronger treatment almost always makes things worse. So, what does skin barrier repair actually mean? Because this is a term that has often been misunderstood, and it doesn't mean stopping skincare completely. It doesn't mean piling on multiple soothing products. And it definitely doesn't mean jumping to stronger treatments to push through irritation. So, skin barrier repair is a control process. The goal is simple: to reduce inflammation, to restore hydration and lipid balance, and normalize how the skin responds to products. So, once the skin responds predictably again, the treatment becomes safer and more effective. So, personally, I approach skin barrier repair in three clinical phases. One is calm. In this phase, it's about removing the trigger. Anything that stings, burns, or causes redness needs to be paused, and that includes any active ingredients. The focus here isn't reducing irritation, but supporting skin tolerance. Restore is number two. And what you want to restore is hydration and lipid balance. This is where simple routines do much more than complicated ones. The skin starts holding moisture better and reacting less. Number three is to strengthen, and in this phase, I prepare the skin for future treatments. Because the barrier becomes more resilient, the skin tolerates products better, and this is when treatment can now be reintroduced safely. So, skipping these phases is one of the biggest reasons people struggle with achieving long term results. So, alongside the three barrier repair phases, there are certain things that need to be paused in order to achieve maximum results. So, active ingredients, the constant switching of products, and DIY fixes that irritate the skin further. Continuing this while trying to repair the barrier is like trying to heal a wound while reopening it daily. So I'm sure some of you are already asking, and how long does the barrier take to repair? Frankly, how long repair takes depends on the degree of damage. Mild barrier disruption may take a few weeks, while chronic irritation can take much longer. So this is where patient matters the most, because rushing the process may actually lead to relapse. So once you've given your skin barrier time to repair, then you'll notice clear signs that your skin is now ready for treatment. And that's when products no longer sting, moisturizer feels effective, redness reduces significantly, and the skin feels stable rather than reactive. So now this is when treatments for acne or pigmentation begin to behave the way it's supposed to. So in the next video, I'll be reviewing popular products in the market that claim to repair the skin barrier and breaking down whether they actually support repair or just sound good in marketing.